billion people put together. Then Christine Lagarde, Managing Director of the International Monetary Fund, and Barack Obama have both spoken strongly about the risks posed by inequality in recent weeks. And here in Australia, this conversation has only barely begun in earnest. But our first speaker this morning, Dr. Andrew Leigh, MP, is uniquely qualified to open the batting on this, as he, more than anyone else, has initiated the national conversation on our increasing inequality. A distinguished Professor of Economics here at ANU before he began his parliamentary career, Andrew is now the Shadow Assistant Treasurer in the Australian Parliament and the author of an important book, Battlers and Billionaires, The Story of Inequality in Australia. Andrew is going to set the scene for this discussion on power, money, resources and inequity. Over to you, Andrew.
Well, thanks very much, Bob, for a very generous introduction. And I, of course, acknowledge the meeting on the traditional lands of the Ngunnawal people and pay my respects to their elders, past and present. I want to acknowledge Bob as our chair, Sharon for bringing us all together today. Creating a conference is wonderful fun on the day, but it entails plenty of stresses in the lead-up as you sort out presenters and venues and catering. And I've done it myself, and I'm greatly admiring Sharon for bringing us all together today. As Bob mentioned, I used to be a professor here, which meant I used to come along to events like this and give substantive contributions. Now, as your federal member of parliament, my role is more in the nature of a priest who comes along in the morning to bless the gathering, to assure all of you present that what you're doing has policy resonance. And with a topic like this, that's not hard to do. Average health outcomes have been one of the great successes of the post-industrial revolution era. We have life expectancies now that are undreamt of at the time at which a little island off the coast of Europe began to transform world growth rates. It's kind of hard to think about it now, but you just need to go back a few generations and you reach a time when about a quarter of all parents had one of their children die before them. Where life expectancy was decades shorter than it is today. We're debating a pension whose age was set at a time when its level was above the average life expectancy. And we're now in an era in which life expectancies are still growing rapidly. Life expectancies are growing every decade by 2 years. Meaning that if we continue on that trajectory, a child born today has a 50-50 shot of living to 100. Public health has had an important part to play in that. One of the huge advances in public health are those sanitation improvements of the late 19th and early 20th century that come from iconoclastic public health researchers willing to challenge existing wisdoms. One of the great public health stories is that of John Snow, the health researcher who noticed a pattern of cholera deaths in London, in the Soho area, and finally managed to track them down to the fact that each of those who died was getting their water at the same pump in Broad Street. And so, to the great anger of the local residents, he removed the handle of the pump. Cholera deaths plummeted. And John Snow is now seen as one of the great savers of lives that public health has known. And these continual improvements have now spread out to other areas. The changes in smoking over the last couple of generations have been monumental in terms of saving lives. The end of World War II, half of Australians smoked, and now it's down to less than a fifth. And we're pushing now on things like plain packaging of cigarettes, which we, as a Labor government, could not have done without public health researchers providing the evidence. We've got challenges such as obesity and binge drinking, and they're areas where governments and public health researchers are working hand in hand. But at the same time, we've got gaps. And sometimes we forget how big those gaps are. The rich, on average, will live 6 years longer than the poor. That's 6 more Christmases to enjoy with friends and family, 6 more years of great movies and great books. And what people wouldn't give for those 6 more years on the planet. We know if we look at those with incomes under 20,000 and those with incomes over 80,000 that we have gaps in the number of teeth in people's mouths. The rich have 7 more teeth than the poor. 7 more teeth. That means when a poor person smiles, it's a different smile than when a rich person smiles. That affects outcomes in self-esteem, in the labour market, and yes, in the marriage market. And so closing these health gaps, thinking hard about health inequities, is absolutely vital in Australia. I mentioned before that we brought down average smoking rates to less than a fifth. But if you look at Indigenous communities, they're still closer to a half. Rural and regional Australians smoke more, and low-income Australians smoke more as well. And obesity, too, is strongly tied in with income. And so one of the huge challenges for us now as public policy makers is to close those health gaps. And that's why what you're doing here is so important. Because governments can't just think about averages. We have to think about the distribution. One of the things that frustrates me intensely is where people at the top of the socioeconomic spectrum who work in desk jobs say that it's okay for them to access their superannuation at 60, but that a poor person should wait until 70 to get the pension. Someone put it recently about the same debate in the US. We've now got an argument that a pension that was set up to avoid elderly poverty should now be changed in a way which will mean it does less to reduce elderly poverty. Because once you know that those at the bottom of the distribution die 6 years earlier, that makes you think about the 6 years less of access to retirement savings they'll get. And once you think carefully about the kind of back-breaking jobs that low-wage workers do, you start to think that maybe it's not so fair if someone who works at a desk job, like we do, gets to access superannuation at 60, but someone who cleans those offices has to wait until 70. Thinking about equities lets you think about a whole lot of public policy problems about it. So thanks for having me along today. Thank you all for engaging in an important conversation and a cross-disciplinary conversation. Something that ANU does as well as any other institution. Thanks particularly to Sharon, to Bob, and to all of the panellists today. And I wish you all the best for a set of productive and stimulating conversations. Thanks very much.
I suppose the reason I was given the privilege of chairing today was that with Sharon and Andrew, I chaired a round table on inequality at Parliament House about nearly 2 months ago. And that report is weighing heavily on my mind at the moment. hoping to learn lots of new insights from today's discussion. But it's very fitting now that Sharon, who's been the brains behind this discussion and who has an international reputation for her work on health equity and her involvement in the social determinants of health work of the WHO, should move into this next phase of the discussion because it brings together the inequity issue and the health issue. Thanks.
I'm a public health academic, I've got to have slides, so I'm so embarrassed following Andrew. So thank you, Paul, and thank you, Andrew. Really, some of the points that Andrew has made so eloquently are some of the things that we have been grappling with globally for many years. And the question of why today? Why are we all here in this room today? Why is it something that we might be concerned about? We should be concerned about it 5 years ago, 10 years ago, 100 years ago, but why now? And really, the aim of today is to lay bare some of these big structural drivers that I and many others, I suppose internationally, would say because of the power inequities that exist between countries and within countries, it just keeps getting pushed underground. And I think it's why it is absolutely fantastic that we have got somebody like Bob and his Australia 21 and a parliamentarian like Andrew who said this is something that here in Australia we're going to take this on in an incredibly challenging time within our country. So that's not to be underestimated exactly what's happening. So today is laying all of that bare and really trying to think about what can we do. Of course, I'm going to problematise this, I always do, but what we're trying to get to is what are the sorts of things that can be done really far upstream in some of these big, hard political domains. We're going to speak about a number of those policy issues. So here I'm going to scroll in some of the various colleagues' slides and points really to flag, I'm going to flag what some of these policy issues are. So whether it's to do with social protection, taxation, labour, a whole range of policy issues, but I've deliberately called the session Power, Money and Resources to make the point that yes, we can do things, we must do things across sectors, but unless we think about some of these structural drivers, we keep coming back to the silos and the disciplines as well. These are highly political issues. It's fantastic to see that we've got a range of people from different policy. We've got, I think, quite a challenging time at the moment within Australia politically and practically in terms of policy development and implementation. So let's really use this as an opportunity today to have a safe space to discuss some of the big hard issues that always get swept under the rug. You're going to hear a recurring theme of power and governance. Peter Rajas will speak about those issues later on. And I'm quoting Richard Horton here, who's the editor of The Lancet, one of the most prestigious public health journals. Health inequity is about power inequity. If we want to improve health, we must analyse power and challenge those with power. And what we're trying to understand today is how do we do that in a way that moves us forward meaningfully. So the aim of today is to have a technical discussion where it's an evidence-informed, I'd like to say an evidence-informed rant on my part, but an evidence-informed discussion about all of these issues. But it's not just about that technical discussion, and it's not also about a tactical discussion. Andrew, I think, probably spends his days working through tactics, also, of course, having all of the technical expertise, the tactics of how do we bring this issue onto the political agenda. Part of us being here, or one of the reasons for us being here, is to help tactically help move that issue forward over the coming months and years in Australia and globally. I'd like to think that today is actually a bit of a call to action to challenge the status quo. If we don't challenge the status quo, we keep reinforcing these inequities in power, money and resources. So that's my grand vision for today. And I thought we'd keep it relatively easy. You see, most power, money and resources is steady. But most of the discussion is quite economic in focus. And that's not to say there are not many, many other structural inequities, so issues of gender, issues of race. We just haven't really, in the space of the agenda today, we've not been able to capture that. But the next time we have this symposium, perhaps that's the sort of discussion we should be talking about. So, Andrew's set the scene with some of the statistics, but being initially an epidemiologist, I couldn't possibly speak without putting up some statistics. But so why are we here? And the idea there's been fabulous developments in average health and length of life around the world, but the fact that there's dark green and light green still on that map is not acceptable. There is no biological reason for those differences in the length of life that people would expect to use. And for us here in the Asia Pacific region, we've got a 27-year gap in life expectancy between countries. That's not biologically determined, that is quite deliberate. Somebody made the decision, or a number of people made the decision, either to not do something to address those inequities, or not to do the right sorts of things to address those inequities, and therefore helped perpetuate that. And we've got the socioeconomic gradient, of course, here in Australia. These are some data from the 45 and Up study, which just really is just to demonstrate that we've got a social gradient. If we only focused on the poorest of the poor in this country, we miss the fact that there are very large proportions of people in the Australian population who need help, both in terms of these two examples of diabetes and of depression. So we've got to think about the whole of the socioeconomic spectrum. And in the World Health Organization's Commission on Social Determinants of Health, we put this text on the cover of the final report. And as you see, it makes this point that these inequities between health inequities between countries, within countries, are not due to natural, it's not a natural phenomenon. It's absolutely about poor social policies, unfair economic arrangements, and bad politics. And that's everything that we're about to speak about over the course of today. It plays out in people's life. I haven't put up statistics for this, but it plays out in everyday life. So this idea of the daily living conditions that we all experience. Who is it that experiences good quality education, access to good quality education, access to adequate income, good quality employment? We know that's vitally important. Less access to affordable housing and enjoyable neighbourhoods, and so on. So that's our daily living experiences. But what is it that determines these the social variation in these daily living experiences? Again, it's not just a chance. It's about this distribution of power, money, and resources. And if we put people, health, well-being at the centre of all of this idea of empowerment, having enough material resource, enough psychosocial control over our lives, and political voice. The evidence tells us these dimensions of empowerment are vitally important, which are shaped by our daily living conditions, so our education, our work, where we live, etc. And all of that is differentially affected by this distribution of power, money, and resources. And really, I think very reassuringly, very recently, at the start of this year, there was the results from the Lancet Oslo Commission on Global Governance for Health. And after a 2-year process of reviewing the global evidence base, colleagues identified these, what they call 7 political domains that shape health and health inequity. And we're going to speak about a number of them today, both in the presentations this morning and in the panel discussion that we recorded for Radio National. So issues of finance, intellectual property, trade and investment, and corporate activity in particular. But why is it that inevitably at the policy level we get what's been termed the lifestyle drift? We get back to the individual level of responsibility, back to the behavioural risk factors, which of course are very important from a health perspective, of course they're very important, but we shift in that policy direction, we shift to some of those things of, and I've just given the example, and apologies to colleagues who've worked on the Swap It campaign, it's important, but it has to be in a broader context. We swap fried food for fresh food. Well, that's all very well, but think about your broader daily living conditions. Do we support you to do that? And why is it in the first place that we're swamped with fried food? Why are we not completely saturated with fruit and vegetables? And why is that not things that we're bombarded with? We're bombarded with every other foods. So this lifestyle drift, and I would argue again, it's the distribution of power, money, and resources. So let me move into each of these just a little bit. So of course, how society runs affairs, how it runs its affairs and how it distributes money throughout society really influences our daily living conditions, the conditions that are so important for how we are born, where we grow, we live, we work, we age. And money is so important for not only what we can purchase, so our purchasing power, but our prestige. And when we think about how that then starts to get distributed, both purchasing power and prestige affect physical and mental health. So, for the economists in the room, the Preston curve, everybody appreciates what the Preston curve tells us. With increasing levels of national economic growth, for want of a better word, for national GDP, life expectancy increases, but then it plateaus when we get to that a certain level. Life expectancy starts to plateau off. And Preston acknowledged that actually over so 1975 to 2005, the gains in life expectancy due to economic growth could only account for about 16%. Economic growth accounted for about 60% of that gain in life expectancy. There was other things happening that were important. But money matters. National wealth is important for health, but it may not be the most important thing, certainly in high-income countries like ours. And of course, that is not distributed equally as I'm worried at all. This is the wealth pyramid from last year, and you can see the distribution. I just pulled out one of the top line figures. So less than 1% of the world's adult population controls more than 40% of the world's wealth. And you can see at the bottom of that pyramid, there's about 3% have the smallest amount of money, about 69% of the world's. So major inequities in terms of that control of wealth. And Andrew's gone, I was doing a plug for his book. What he spoke about so eloquently, he doesn't need the slides to remind him what it's all about. But his book, Battlers and Billionaires, points to that sort of inequity within Australia. And you can see the differential growth in wage, and this is for our sort of standard salary wage, how that's grown between 1975, very minimally for people in the lowest 10 percentile compared to those in the top 10 percentile. So an inequity with how that money has grown over time, what work is one of the ways that we can think about distributing health, distributing money with implications for health. But we now have a very, very precarious employment environment, and I've just pulled on some work from colleagues in Spain, colleagues here in Australia at MCHP have been doing this and really identifying that the quality of work absolutely matters. But if you think about How many people in this room are in permanent positions? How many are in contractual positions? How many don't even know how long their contract is going to last? That's very socially distributed when we go out into the wider population in Australia. People in lower socioeconomic groups are much more likely to be in those much more precarious employment positions, and you can see what it means, particularly with poor mental health, is much higher in those situations. I'll flag David's book. He's going to speak about austerity, social protection. You can make a choice whether you want to look after the population or not, and depending on that social policy choice makes a difference. I've just pulled out a few of the statistics and explain all of that much more eloquently than I am. And just, I'll flag some work that we've been doing up in Sydney. So something which may seem so dull, a healthy and sustainable diet, very important for population health, very important for planetary health, if we think about environmental sustainability. And if that's something that we're trying to promote from a health perspective and from an environmental perspective, which is what we're trying to do in Australia and globally, who can afford it? The lowest socioeconomic groups would have to spend about 48% of their weekly income to meet that healthy and sustainable diet. That would only be about 9% of the weekly income of higher socioeconomic groups. So even if lower socioeconomic groups wanted to eat healthily and sustainably, 49% is not doable. Once you get above 30%, it starts to break down. That's a social policy issue, as well as, of course, something to do with food price. It's a social policy. It's about, do welfare payments, does minimum wage reflect the real cost of living, inclusive of food? What about resources? I'll mention trade. I've picked on trade as thinking about how we distribute resources. Trade is all about the distribution of power as well, but we'll speak much more about trade in the panel discussion. But let me just mention a little bit about it. I want to pick on the bottom part of food security and nutrition. For those of you who were at the session last year, you would have heard myself and Annie Leithau, who's up in the back, speaking about trade and food in particular. So let me just mention some of that again. We've got this ridiculous situation globally that we've got about 1 billion people who remain undernourished and about 2 billion people who are overweight and obese. So this paradox of under and overnutrition, as it's referred to, sitting side by side often. And it's partly three big drivers of that, partly to do with trade liberalisation, foreign direct investment, and globalised marketing and promotion. Within the trade space, there's these 4 pathways that affect nutrition and health. The foreign direct investment pathways, some work that we've been doing, I should say a lot of these points that I'll make are part of an ARC project that we've been battling with over the past 3 days. But this idea of convenience keep, so the big transnational corporations being facilitated through greater foreign direct investment as part of the new forms of trade and investment moving into countries across Asia. Why is that an issue? Well, from a health perspective and certainly from a nutrition perspective, you see this growth in highly processed, so high fat, high salt, high sugar foodstuffs. Now, that meets trade and investment goals, that distribution of products, of course, but there's real incoherence with nutrition and health goals in that context, and we need to think about how we address that. Some work that Anne-Marie's been doing around labelling and thinking about technical barriers to trade. So just an example of how trade agreements encroaching into domestic health policy space. So in Thailand wanted to introduce on the children's snack foods, they wanted to introduce this traffic light system that tells you if a food's high in fat, high in salt, high in sugar, it's red and red. And when from the Ministry of Health perspective they said we want to do this from a health perspective, that was shut down because it was a technical barrier to trade, so it was in contravening trade agreements. Which, yes, we need to think about that from a health policy perspective, being trade compliant. So again, this point of incoherence. And what we ended up with in Thailand on the foods was this warning label, which from a nutrition and a health perspective really doesn't apply to the mustard. No pun. And again, drawing in Anne-Marie's work, I should point that out, she's sitting up at the back. Any questions on this work to speak to? So from the, how does trade distribute foods? Partly through imports and tariffs, of course, and in some of the Pacific Island countries, the importation of mutton flaps, particularly from New Zealand. So mutton flaps coming into the Pacific Island countries, high in salt, high in saturated fat, so countries that are already experiencing high levels of overweight, obesity, and particularly diabetes. So the health minister is saying we've got an issue with the volume of imports of these particular foodstuffs. It's a concern from a public health perspective. Can we cap the amount of imports of this food into the country? And at the time, when Tonga was trying to accede into the World Trade Organization, so multilateral being part of the global trading system, important from a development perspective, arguably, there was again this tension between the trade goals and the health goals. And then just finally, this idea of how trade might influence tax revenue base or government revenue base. Some of what we believe being discussed within the PACER Plus agreement, so again within the Pacific Islands, if PACER Plus goes ahead with the drop in tariffs that's been proposed, so the Pacific Island countries would have to really lower all of their import tariffs, which act as an important government revenue base. What might that mean for their government spending on other programmes of work? And some analysis done by Oxfam suggests what the PACER Plus revenue loss would look like sitting alongside current education and health spending. So it's a flavour, none of this is cause and effect at all, but it's to give you a flavour of how thinking about the distribution of resources, possibly through trade and investment, will play out from a nutrition and ultimately health equity perspective. And we're concerned about the current discussions that are going on within the Trans-Pacific Partnership Agreement. We will discuss this in much more detail in the panel, but really the Trans-Pacific Partnership Agreement is currently under negotiation with 12 countries, and it's very, very much about investment. And if some of the points that I've made about investment from what we know from previous trade agreements play out within the TPP, and we're going to have to think very carefully from how we mitigate any potential harm for nutrition and health. And then to wrap it up under power, and so as I said, Peter will speak more about sort of power and governance issues, but power you can think about at the individual level, and this is drawing on Sen's idea of freedoms and capabilities. So having material resource, having control over our lives, having voice in the decisions that affect our life, having voice in how that plays out. These are all elements of empowerment. It's the same idea when you take it up to a community level or when you take it up to a national level. You're sitting around that trade negotiating table. Who's got voice in the trade negotiating table? Who's got control over the agenda at the negotiating table? Similarly at the individual community level. And it absolutely matters. These are some data that we used within the Commission on Social Determinants. But power, and in this instance self-determination by Indigenous communities in Canada, First Nations peoples in British Columbia and Canada, having self-determination was all about power and control over agenda setting, over policy development, and over service policy implementation. Control of these factors down the right-hand side, you see the more control of those issues. This is a drop-off in youth suicide rate, male youth suicide rate in British Columbia. So it absolutely plays out through to health and to death experiences. And as I mentioned, this Lancet Commission, the political origins of health inequity, all about power, they flag these are 2 key points that they speak about, and you can see these notions of the norm setting, which I'll mention in a second, through these big track, but they're particularly talking about global health issues, global governance issues, and the power asymmetries therein. Who controls our global economy? You might have seen this in The Economist a few years ago. So we think there's a whole load of transnational corporations that are there within the centre of the global economy. But actually, there's less than 1% of that 1,300 companies and corporations. Less than 1% control 40% of that network. And most of them are banks or investment funds that get this tight control. How does it play out within the food? You know, I always speak about food in many of my talks. So there's 4 agribusinesses control the global supply chain of grain trade. That's 4 businesses. What does that mean? And one of them, ADM, were the ones that were involved in the discussions with SPC. What does it mean? What we've seen is this concentration of power at the top of the supply chain, which means that there's the large-scale land acquisitions. It's partly driven the biofuel investment discussions, and it's about, you would have seen the discussions around food price speculation, and that being a major driver of the food price hikes in 2007, 2008. When food doesn't become about something, it becomes something that you trade away in the future. But really how that plays out is down the supply chain in terms of price volatility, which is knock-on implications for what people can afford to consume, and it has implications for what actually gets grown, so the control of the types of foods or the types of grains that gets out into the global supply. We also see much more corporate engagement in governance, is the diplomatic way to say. Our tobacco companies trying to control our national policy agendas, and Matt Rimmer will of course speak about some of this very eloquently in the panel. He's been very actively involved in the cigarette bin packaging issues here in Australia, along with Deb Gleeson. So I won't say anything more about that. But just in terms of governance and shaping norms, so I'm Scottish, I'm from Glasgow. This is a deep-fried Mars bar. Deep-fried Mars bars taste quite nice. It's a cross-section of a deep-fried bar. And this is you buy, so you can see it's simply greaseproof paper. So this is the purchase from the chip shop or the fast food outlet. So deep-fried Mars bars are very readily available. They're so there's a proliferation of fast food outlets in every street corner in Glasgow. Very readily available, relatively cheap compared to, you know, if you're in the supermarket next door with fruit and vegetables. Who wants to buy fruit and vegetables from expensive, relatively cheap Mars bar? And it's now culturally acceptable. If you go into some of the more high-end restaurants in Glasgow, you get a deep-fried Mars bar, served beautifully with all sorts of juice down the side. But that's now what comes on the plate, so it's quite culturally acceptable to purchase this. And so this idea of normalising through product positioning, through using the levers of the retail and marketing, starts to normalise the sorts of foods that we can think about. So to finish, and at the last slide, today is all about how we rebalance some of these things that I've alluded to. I've of course not gone into any of them in great detail, the other speakers will do that. How do we rebalance that distribution of money, the distribution of resources, and ultimately the distribution of power in a way that meets a whole range of policy goals? Trade goals, health goals, economic goals. We need to think about those coherence between those goals.
Thanks, we're going to reserve discussion for after we've heard from David Stockman. We're delighted to have him here visiting, and even more excited by his title, Body Economic, Why Austerity Fuels.
It's a tremendous pleasure to join you coming from the UK to talk about one of the most critical rebalancings about to happen in Australia, and that's the Abbott government's pursuit of deep austerity measures. My expertise is in Europe, and we've been studying how budget cuts have been affecting health there for the past 5 years. It's now, in Europe, about 7 years since the worst depression since the Great Recession began. And the storm has not yet passed. People have lost homes, they've lost jobs. In parts of Spain and Greece, more than 3 in 4 youth are looking for work and can't find it. A generation whose hopes have been dashed, blighted by the labor market. And meanwhile, amidst a period of enormous suffering, politicians have been talking endlessly about how to deal with debts and deficits, some created by huge bailouts of the banking sector, all with little regard to the human costs of their financial choices. Too often in this debate, the stories of real people whose lives hurt go unheard, go unnoticed. Since Sharon is from Glasgow, I wanted to share with you, introduce you to Kieran McArdle. Maybe wondering who he is. A 13-year-old boy at this ripe age. As you can see, he's already bitter. He blames the government for killing his dad. Maybe hard to see at the back. He's holding a picture of Brian McArdle, who worked for 20 years as a security guard in Glasgow. Until last year, he suffered a massive stroke, left him paralyzed, blind in one eye, and unable to speak. With a few choices to make ends meet, he turned to the government for support, signing up for incapacity allowances. But that government, and the hands of the UK Tory party, would prove no friend to the McArdles. For in an effort to tackle what they called an epidemic of welfare scroungers, they hired a French systems firm, Atos, to conduct fitness for work screenings for all persons who were disabled. And so Brian, like many others, was called in. He was a little concerned because more than a quarter of these screenings were taking place in buildings that weren't wheelchair accessible. But Brian went to the meeting, he did his best. 2 weeks later, a brown envelope came through the post. His benefits had been cut with immediate effect. The next day, he dropped dead. This time, from a massive heart. And that's why Kieran blames the government for killing us. Now, as a public health researcher, it's been extremely difficult to understand the government's logic in this conversation. What I have here is a slide from the Department for Work and Pensions, estimating the annual cost of fraud and persons thought to be cheating the system. And in the year Brian's support was cut, that estimate was about £2 million. A contract with Atos to perform mass screenings is costing taxpayers £400 million per year, costing taxpayers more. And this is but one example of how measures taken in the name of austerity have had the opposite of their intended effect. Intended to shrink deficits and debts have actually cost societies more. In Europe, austerity has been a massive experiment on her people. The early economic signs of its consequences are becoming readily apparent. What I have here is a comparison of the US and the UK, two countries that were at the epicenter of the toxic housing bubble and the eventual collapse when it came tumbling. And you can see the dashed line, the dark line, UK and US respectively, both had a crash. Both nations bailed out their banks, began to chart slow, steady recovery, until a turning point came in the UK, shown with the arrow, when the UK transitioned to the Tory government, began on a path of deep cuts, when growth flatlined. And that graph depicts what is now known as the worst recovery from a recession in the history of recessions. But I don't want to talk too much about the economics, important as they are. I'm here to talk about health. And what I have here is a well-known link between social protection, investments in early childhood development programs, straight through to old age pensions, and its association with greater life expectancy. What I'll argue is that those countries that weathered best economic hardship have almost always had the strongest social safety nets, the strongest social protections. I'll argue that the link between social protection and health is not a mere correlation, but a powerful cause and effect relationship seen across societies and over time. So to test out this welfare thesis, we've been looking at cases from the recent recession. And at one extreme, there's Greece, which is in the middle of a public health disaster. To meet the budget deficit reduction targets set by the International Monetary Fund, the European Central Bank, the European Commission, the so-called Troika in Europe, Greece's health spend has been capped at 6% of GDP. Where that figure came from is uncertain, but in practice, it's translated into deep cuts. An incredulous journalist asked the health minister, "Are you really going to cut the hospital budget by 40% in 1 year?" And the minister threw up his hands and said, "Look, these are cuts, not with a surgical scalpel, but a butcher's knife. We have no choice." Now, in epidemiology, often there's a long lag time between, say, smoking and the onset of cancer 2 decades later. These cuts have rapid effects. One example is after the HIV prevention budget, particularly funding for providing clean needles to drug users, was slashed by over half. Starting in 2010, HIV rocketed, making Greece the only nation to experience a resurgence of HIV that had been held at bay for the past several decades. And what you see here is the outbreak concentrated in injection drug users in red started not when the recession began, people lost jobs, homes, plunged into poverty, but when the cuts took effect in 2011 and ongoing. The World Health Organization estimates there should be about 200 clean needles per drug user. After the cuts, street charities estimate there are about 3 per user in inner city Athens. Another example. To meet budget deficit reduction targets as part of their austerity package, Greece cut their mosquito spraying programs in the southern part of the country, giving rise to return of malaria, a disease that had been considered all but eradicated since the early 1970s. And I could go on. In a paper hot off the press a week ago, published in The Lancet, documented a series of cause and effect harms from austerity on the people of Greece, leading now to panic in the streets as pharmaceutical companies such as Novo Nordisk have pulled out in arrears, stripping them medicines from the shelves from insulins, antidepressant meds people had relied on. But I don't want to go too far with the disaster in Greece. Troubling as it is, this is happening in Europe today. I want to bring your attention to another economic disaster, which we can learn lessons from in Australia. But bring your attention to Iceland. If you were in Reykjavik back in 2008, your TV program would have been interrupted with this map. Prime Minister Hart, with block letters saying, "God bless Iceland." He called an emergency announcement warning Icelanders of the greatest period of hardship since World War II, warning Icelanders of national bankruptcy and default. And he had a point. All of Iceland's banks had failed. Its debt rocketed to over 800% of GDP, a figure higher than Zimbabwe, the largest debt recorded. It was the biggest banking crisis relative to the size of an economy in history. Faced with few options, who would lend to a nation that just squandered all of its banking assets? They too turned to the International Monetary Fund for support, signing up to budget cuts totaling 50% of its GDP in the next 3 to 5 years. I remember being at a conference in Gastein, the health minister. We took to joking, what's the difference between the IMF and a vampire? He said, one stops sucking your blood after you're already dead. These were eye-watering cuts. Then something quite different happened in Iceland. People took to the streets in mass protest at the plan to repay bankers' greed with deep cuts. The equivalent here in Australia would be if you had 5 million people storm Canberra in protest of the Abbott government's austerity plan. These protests were clearly noticed. The health minister I just mentioned resigned rather than introduce draconian cuts, and forced the president's hand to call for a democratic option, a referendum on cuts, asking people what they wanted. And in March 2010, 93% of Icelanders voted no to the plan to make deep cuts, to sacrifice to repay bankers' heirs. And did it cost them? Did this plan, this unorthodox plan that the president has described as going against the financial orthodoxy of the last 30 years, letting the banks fail, providing support for the poor, and rejecting austerity, did this plan cost them? We looked at data with public health colleagues in Iceland before and after the crisis. And rather than make deep cuts, Iceland let its stabilizers work. Spending increased into the crisis. Unlike Greece, we saw no loss of access to health care, even as the price of imported medicines rose, thanks to the Icelanders injecting spending into the system. The unemployed, who so commonly report being depressed, anxious, feeling hopeless about the future, and Iceland said they were sleeping more and spending more time with their families. And it even had a positive, surprising effect on nutrition. McDonald's pulled out of the country, citing operational difficulties. Apparently importing tomatoes was the most expensive part of Big Mac. I hadn't realized tomatoes were in Big Macs. But people turned to locally sourced fish, helping power a domestic boom. And the International Monetary Fund, incredulous, couldn't argue with the results, couldn't argue with 5% economic growth and unemployment rates hovering at 4%. And you can see the tale of the two nations, Iceland rebounding, where Greece, the latest data we have, 2011, shows its continued sink into the abyss. So what does this mean? I don't want to go too far. These are obviously two extreme cases. Iceland's a tiny nation. It sits outside the Eurozone, which gave it the option to devalue its currency to power growth, where Greece, as a member of the European Monetary Union, had no monetary options and fiscal policy was taken off the table. But what the contrast proves is that even a terrible economic crisis needs not lead to a health disaster if politicians take steps to protect the health of their people. Fiscal policy is a matter of life and death. Austerity is a choice, and it's a choice we don't have to make. To test out our thesis, we've also looked at historical crises. One that's been invoked a lot recently, also in Australia, is the Great Depression. And what may come as a surprise to you is to know that, much like Iceland, in the Great Depression, mortality rates actually fell in the US. Shown here, in 1929, when the crisis hit, mortality dropped. Now, there was a lot going on at the time. When we drilled into the data, we found much of this was from road traffic deaths falling. People were saving money on fuel, driving less, and at the time in the 30s, road safety was a foreign concept. But what helped prevent so much harm as it's recent today? The challenger president at the time, Franklin Roosevelt, campaigned pledging the Americans to a New Deal, the birth of the U.S. social safety net, a massive expansion of relief to the newly unemployed, to build hospitals, schools, the sanitation programs we heard earlier from Andrew that were so critical in improving health. And what we found is it created a natural experiment, much like what John Snow had looked at earlier, where some states in the U.S., for ideological reasons, rejected the New Deal, where others went even further. And we found this created a lasting polarization across the U.S., where those left-leaning states invested more in social protection systems, invested more in relief, and had significant drops in suicides, pneumonias, infant deaths, to name a few of benefits. This was the biggest public health program implemented to date on U.S. soil. We can also learn from contrasts, and one comes from the Asian financial crisis, another economic disaster we've lived through. And what I have here is Thailand's case, which was at the center of the currency crisis. It too turned to the International Monetary Fund for support, signing up to a 50% cut in its HIV prevention programs, and much like Greece, we've seen a similar pattern where HIV mortality rates rocket in the crisis. Only now, decades later, coming back to the level it was before. The costs of these mistakes can be enormous. It was only in December 2012 that the International Monetary Fund apologized to Thailand, noting that the harm from its austerity recommendations had been 3 times greater than previously assumed. And it's important that we take stock of these successes and failures and learn from our mistakes. And I'm very pleased to see that recently the International Monetary Fund again apologized to Greece. In a paper published last November, the chief economist of the International Monetary Fund noted we underestimated the negative effect of austerity on employment and spending power. This is a debate that's very important to us earlier today, and it hinges on an obscure statistic known as the fiscal multiplier. It's a statistic that describes the effect of government spending on the economy. So when this multiplier is greater than 1, it means for each Australian dollar you spend, you get more than $1 back. So it makes sense to spend. When this statistic is less than 1, it means you can save money through cuts. The IMF had assumed the multiplier was about 0.5, but when the economists took a hard look at the data, they realized it was positive, about 1.7. But even this suffered a major assumption that I hope our students in Oxford wouldn't make. And that's it assumed all government spending affects the economy in equivalent ways, which is clearly implausible. We wouldn't expect defense, education, and the environment and social protection to have a similar effect on our economy. These are completely different sectors. So we revisited the IMF's methodology, but disaggregated for the first time different targets of spending. What I have here is a forest plot of the fiscal multipliers by type of government investment. What we found, you can see on the right, is that health, education, environmental spending has some of the biggest and most positive fiscal multipliers. Whereas defense and economic affairs, which are bank bailouts, were smaller and in some cases negative, as money flowed out of the economy, in the case of defense to foreign contractors, in the case of bank bailouts to offshore tax havens. So even if you wanted to pursue austerity, there's a strong economic case to use a data-driven, smart approach that will call for protecting health, education, and social protection. And we can see this multiplier in action when we look at which nations have recovered fastest from the recession, with change in government spending here on the x-axis, change in GDP on the y, and at the bottom left you can see Greece, very slow recovery, and at the top you see Finland, Japan, Germany. Germany reaches the virtues of austerity for others. So I believe there is an alternative. Collectively, we've lost sight of our histories. And I turn back to a great hero of mine, Nye Bevan, the health minister of the Labour government in the UK after World War II. And he said, despite our financial and economic anxieties, we're still able to do the most civilized thing, put the welfare of the sick in front of every other consideration. He was speaking at a time where Britain's economy was in shambles, debt was at a record peak, 400% of GDP, compare that to Australia, we've got about 20% of GDP to deal with. And he was speaking on the eve of founding the National Health Service, a massive expansion of public health, creating a commitment to universal care, free at the point of service for all who need it. The economic consequences are clear. At the eve the NHS was founded was a turning point in the history of British debt. Within a decade, it fell in half and continued to fall and fall, the multiplier in action, until we get to the early 80s where debt swings like a pendulum and begins upward rise and rise, continuing today. So my plan for Europe, plan that has elements I believe would work in Australia, I call it New Deal. And at its heart, it has three guiding principles. First, do no harm. This ancient law of higher healing should guide our economic policy. Had austerity been run like a drug trial with a board of ethics, it would have been stopped. Australia can set up an office of health responsibility, cross-party, staffed with economists and epidemiologists that monitor the impact of austerity on its most vulnerable groups. Second, we should treat unemployment like the pandemic it is, a leading cause of alcoholism, suicides, anxiety, heart attacks, to name a few. What we've learned, I don't have time to go into all the details, that smart spending on programs that help people return to work, so-called active labor market programs, that link the unemployed with action plans, caseworkers, can prevent suicides, as well as ready the economy for recovery. Finally, we should invest in public health. The irony is that the epidemics Greece is now in the grip of, malaria, TB, drug resistance on hospital wards, HIV, it could go on, cost you more to control than they would to prevent. New York City learned this the hard way when it cut its TB budget in the 1980s, saving $100 million, only to have a drug-resistant TB outbreak on its hands that cost ultimately more than $1 billion. Investing in health is a wise choice in the good times. It's an urgent necessity in the worst of times. Bit of shameless self-advertising. Body economic. Find out more. Make a difference. Thank you.
Can I suggest you both come out to the front? And we have 10 minutes for questions. And that means you have to keep them very brief, and the answers have to be very brief. If we can get a few good questions in. This might be the time for me shamelessly to do my own advertisement for the launch of Jeff Davies' book this afternoon at 5:30 in the Innovations Theatre. I'm launching it. Entitled Sack the Economists and Disband Their Departments. We're open for questions.
Anybody with research
Julie Smith from you spend a body of research on the importance of the care economy in providing health and maintaining. I wonder if you put to any research on the relationship between cuts in spending money and the efficiency of the care economy.
This may not be on. Just that UK has had a mysterious rise in deaths in people over age 85, and we're in the early stages of working on it. But we're finding many of the cuts in the health sector have cut nurses, mid-level staff, and administrators, and are leading to care bottlenecks in these parts of the country. So what I have are some early evidence showing the consequences, or as you said, the care economy. One challenge we face is that, unlike financial information, which is up to the millisecond for stock market data, much of our health data are 3 years out of date. So by the time we can see the full consequences of these cuts, it's often too late.
Yeah. A question?
Hi, my name is Amanda Pearce. I just wondered about a natural experiment that we might see in relation to the national insurance scheme and trial sites will be commencing or have commenced, and how we could be watching those for the sorts of multiplier effect that we're talking about. Because a lot of those trials are actually happening in areas where there are disturbance. So just wondering how, your comments, your observations or views on how we might look for evidence there of the multiplier.
Obviously, the ideal approach would be a randomized trial. What we found in the UK is politicians will often cite pragmatic or ethical barriers to do them. When we look in more detail, real reason is they already know the answer, so why bother? But what we found is there are some low-cost ways that you can inject just an element of randomization into these programs so that we can learn from their effects. I've been happy to meet with you after to suggest some of those. And I should hand over to Sharon, who's leading a major research program in Australia. Oh, NASA business.
Well, I suppose all I would say about that is we do have great data in Australia, and take the real, it's a real opportunity to use the data. And often, what's been quite fantastic with David's work is using data that's there in very creative ways. And perhaps now a bit of a stimulus to think about how we get creative. Because we've got a whole load of data in Australia that do a lot of what that we've seen, whether it's through an RCT approach or not, but we'd be very happy to have a discussion afterwards to see how we do that.
Thanks. Just I welcome your views on how this debate is playing out in the policy space in the UK. Sharon, your views in Australia. So is it traction? Is it great attention? Is it just passive action?
I've got one slide relevant to that. Glad you mentioned it. I didn't want to go too far on the UK. It's been a huge debate, and one built with a lot of hateful rhetoric towards scroungers, blaming weakest groups in society, disconnected, as shown from the data. If you ask the British people themselves, would they like cuts? It depends on how the question is framed. So what I've got here is one of the leading sources that track British social attitudes over time, and asks people, would you like to reduce taxes and reduce spending on health, education, and social benefits? Over time, that's been less than 10% of the population shown in the bottom part of the graph. And that's what the government has been doing. The rest would like to see spending maintained or increased. So we have the political discourse that's that's convinced the public there is no alternative. Using a metaphor of households over spent, you've got to tighten your belt, and that means spending less. Failing to miss fundamental economic point that we're in an economy together, so if you make a cut, that's cutting somebody else's income, slowing the economy down, leading to the vicious cycle, increasing the risk of debts. This multiplier. So I hope you can draw on our evidence to counter some of the misleading uses of data that you're likely to encounter here.
Although I suppose I would say here in Australia, there's a conversation starting to happen. It might be incredibly difficult in some of those lines, but there is a conversation taking place around inequality, partly driven through Australia 21. We can probably hear more from Richard's speaks. But there's an opportunity as well. I mean, I think externally look at Australia and say, because we're about to go into such prosperity, not necessarily talk that this is going to get incredibly difficult within the Australian context. I think what we're seeing in the conversations we've had so far around within the policy domains for inequality in Australia, there are windows of opportunity. So the disability insurance scheme is going ahead. That's an opportunity to keep this conversation going through that avenue, for example. So I would be, maybe I'm saying this incredibly naively, but I would be so pessimistic in Australia that we have to go through such severe cuts that despite Australia, there's movement happening in Poland and that the Australian institutes now sorts of issues.
We've got time for one more question. Over to you.
I think you've probably just answered this, Sharon, actually, but I was going to make mention of the fact that given that the IMF has been able to recognise that it erred in its advice, in its management of Greece, for example, then, in what way, or do you think it's possible that we're able to persuade the Abbott government prior to its implementation of cuts to education and health, which we're anticipating and coming, that, that it's not the wisest course of action? But I think, in effect, you've just answered that by suggesting that there are avenues which we can practically use to make that case. I don't know if you've got anything further to add about that, but it's certainly interesting to hear that from David about the IMF.
I mean, we've had bailouts of bankers, budget cuts for everyone else. Some of us see this as ideological. It's an opportunity for wealthy elites to reduce taxes and payment into a welfare system that they never use anyway.
And we are starting to see people go on the streets about this, maybe not 5 billion coming to Canada, but there have been protests around the country, local, in Europe, but there is a voice being heard, or being trying to be heard, but I'm certainly not suggesting that the cuts that are right now on the table for health education are not going to be very devastating. But I think the learnings and having support coming out of the voices from people like the IMF and others are saying we want to being creative and constructive, saying, well, lessons from that. Here are all the windows of opportunity in Australia. We might not have a win currently for public health, preventing public health impacts, but there's other ways that we probably get at this stage.
Well, can I thank both speakers and the discussion you've had, and I think they've opened the way very nicely for you, Richard. Richard Dennis is the director of the Australian Institute, and Sharon mentioned the round table we held in Parliament House late in January. It's actually Australia 21 joined forces with the Australian Institute to sponsor that meeting. We're still working on how best to manage the politics of the next 3 months in releasing and using the fairly important finding that came out of it. But one of the very important findings that came out of it for me was Richard's understanding of the taxation system and what it's doing to the Australian quality debate. Over to you.
Thanks, Bob. And yeah, it's always a pleasure to work with Australia 21, and the Australia Institute shares the interest in inequality. We've decided to make it a key focus of our work for the next 3 years as well. So I think there's clearly something in the air or something in the water. But I went out last year and talked to a lot of our stakeholders, and inequality came up in every conversation they had. And in terms of fitting into this conference, one of the other things the Australian Institute's been working a lot on recently is actually the mining boom and the impact on the mining boom, the impact of the mining boom on the Australian economy. So I'm going to sort of try and tie those two things together a little bit. But look, first, because I don't use PowerPoint either, I think power corrupts and PowerPoint corrupts absolutely. That's only because I'm too lazy to put together such great data as I've just been captivated by.
But your Australian data wouldn't look all that different.
No, it doesn't. And I guess I would start with a few observations based on the really compelling presentations that we've heard this morning. The first is, the Australian data looks pretty much like that. No one wants to spend less on health or education. Of course not. It's statistically irrelevant in terms of a democracy. It wouldn't win a seat in Parliament. It wouldn't win a seat in the Senate. Yet it's the dominant view. We're going to spend a bit of time talking about how to reconcile these things, because I do think they can be reconciled, but you might not like my explanation. More importantly, in addition to that, we've done some further polling to try and figure out, well, why? Why would this be? We do a lot of sort of experimental polling. And by experimental polling, I mean we try to run experiments through polling. We'll ask different groups of people similar questions in different ways. We'll try and predict the responses, and then see if our predictive model works. So we recently surveyed 2 different groups of 1,000 people. So 1,000 got what I'll call the left-wing frame for some questions, and 1,000 people got the right-wing frame for some questions. So in relation to this stuff, we asked 1,000 people to agree or disagree with the following statement. Spending money on health and education should be a #1 priority. Okay? About 90% of people agree. 90% of people agree that spending more on health and education should be our #1 priority. Hold that thought. Another 1,000 people were asked to agree or disagree with the following question. Of course, spending money on health and education should be our priority, but we have to get the deficit under control first. What do you think they said? About 60% agree with that. So the groups that drive austerity are far too smart to disagree with us. But they don't disagree. They don't come out and say, I hate nurses, cut their wages, sack doctors. They don't. They say, I want more nurses. I want them more than you want them. And I want them in the future, and I want to sustain more nurses by cutting them today to get the deficit under control. They are smarter, frankly, than us, because they're winning. Look at the scoreboard. Okay, they agree in principle, but they just happen to always disagree in practice. And you saw the data. Ever since we started worrying about debt, look what happened to debt. The whole time we've been worrying about debt in the UK, it went up. Now, I'm an economist, and I hope I don't sound at all defensive today, because I think my profession is used as an excuse for appalling decisions. But please don't confuse the fact that my profession is used as an excuse with my profession doesn't know better. Okay? Don't think for a minute that economists don't know that the multipliers are greater than 1. My PhD thesis was on the obscure fact of fiscal policy multipliers. But no one cares. There's a big difference between we don't know and we don't care. And the IMF hasn't cared for decades. For decades, they've just told us the multiplier is less than 1 and to suck it up. They blew up so badly in recent years, they've been forced to admit what a bunch of economists have been telling them for decades. So please don't confuse don't know with haven't been listened to, right? Because if and I'll talk a bit about this before I talk about facts, but if you think that the problem is a lack of evidence, and if only you put the evidence in front of people, the IMF and Tony Abbott will go, oh, I see. Ah, right. My entire political agenda is wrong. Right. Okie, let me just do what the evidence says. Then you will fail. Okay? Like people have failed before you for decades. So don't get me wrong, this is fantastic data. I love seeing it. And its persuasive power is incredible. And it's forcing powerful people to admit that what they've been saying about economics is wrong. Right? So don't get me wrong, I love it. I've already just Googled the EA. I've sent an email with the EA, buy this book. You know? So I don't in any way mean to say, oh, we all know this, it doesn't matter. I'm saying the opposite. We've known for decades. And this helps tell the story. This is really important. But don't confuse that with people who know. So why would we make such bad decisions? Well, the Great Depression was ended by Keynesian fiscal policy. We don't know how long the Great Depression would have gone on if we'd have stuck with austerity. Right? The reason we don't know how long the fiscal crisis is going to go on in Europe, we don't know how long it's going to last. Because we don't know how long they're going to keep making bad decisions for. Seriously. It's not like the Great Depression ended of its own volition. It ended because policymakers radically changed their economic policies and spent their way out of the Great Depression. We really don't know. And the other thing was World War II happened, and there's nothing that stimulates an economy like a war. You know, wars are great. You have to spend a fortune. And you know what you do with the stuff you build in a war? You blow it up. You're going to build it again. So we don't really know what would have happened with the Great Depression. So you've got to understand the world is the way it is because people with the power to change it choose not to do so. Right? There are people who can change European fiscal policy settings tomorrow. They choose not to do so. Why would they choose not to do so? It's compelling evidence that suggests it's a good idea. It's compelling evidence through economists that says it's a good idea. And strangely, they choose not to do it. It's not a lack of evidence that dissuades them, it's a lack of concern. A lack of concern. They don't want to fix some problems. They're more worried about fixing the balance sheets of banks than they are concerned about fixing rises in AIDS or malaria or suicide or other things. They are more concerned. They're putting their effort into solving the problems they really care about. Now, when they, as you said, when you saw the data, when they set out in the 80s in the UK to start solving the problem of deficits and debt, they failed. Well, how can we reconcile these things? Well, just because governments talk about debt and talk about deficits a lot doesn't mean it's actually the problem they're trying to solve. Please don't confuse what people say with what they mean. Because for decades they've said, I'm very worried about the debt, I'm very worried about the deficit. It's gone up and up and up. But what if, just stick with me here for a second, what if they were lying? What if they were cynically manipulating us and saying one thing and doing another? What better way for them to introduce the suite of policies that are good for them, deliver large tax cuts for those with the most and large service cuts for those with the least? What better way to do that than to cook up a bizarre economic narrative based around scroungers, based around dole bludgers? I mean, imagine if someone was so cynical that they actually used rising debt and rising deficits as an excuse to attack the vulnerable. And then when attacking the vulnerable failed to reduce the debt, what does it follow they must do? Attack them a bit harder. Because look, we've already had a round of cutting benefits and cutting health, and the debt still rose. I guess I'm going to have to give them another dose of the treatment. And if you want to think like epidemiologists and think, oh, well, the dose of the treatment keeps not working, surely they'll stop injecting it soon, then you might miss the key point. And that is that what if what they were really trying to do was transform society in such a way that high-income earners didn't pay much tax and low-income earners didn't get a lot of money spent on them, funded by those taxes? What if pretending to worry about debt and deficit was actually just the best cover story involved for sinking the booty of the poor while cutting taxes for the rich? Okay? So I'm going to talk about tax today, but you've got to understand that here's a real, just stick with me, this is really hard. If governments really wanted to reduce deficits, what could they do? Increase tax. Except we all know that you can't do that. What we have to do is reduce the deficit without increasing tax. And you all know why, don't you? No, I don't. This doesn't make any economic sense at all. But gee, it makes political sense. If you actually thought the deficit was a big problem, wouldn't we try to collect some more revenue? No, that's wrong, Richard. We don't do that. What we have to do is keep cutting taxes while trying to reduce the deficit. And if you're confused, imagine how you feel if you've got a PhD in economics. Because I've spent 20 years screaming at people about this stuff. But the health data is a better way to tell the story than any trick I can. So think about it. For 20 years, for 30 years, we've been told the deficit's a big problem and we must not collect more revenue. In fact, in order to reduce the deficit, we should cut tax. And when that doesn't work, well, we should cut tax some more and cut some services just that we're in deficit. Sorry to sound confusing. I don't understand this stuff. Okay, so let me move on a bit. Oh, and by the way, the stuff about the differential multipliers, yeah, it's great to see. That data exists in Australia. We've been publishing it for years. You spend $1 million on the health sector in Australia, ballpark, for every $1 million you spend on health, you create around 20 jobs. For every $1 million you spend on mining, you create 2 jobs. Factor of 10 difference. These numbers are published by the Pinko Lefty organisation, what are they called again? That's right, the ABS. And they're hidden in the top secret vault called their website. Right? We know this stuff. We know this stuff. This is not hard. Right? But you're missing the point if you think you can go to people that want to cut taxes and spend less on services and change their mind with evidence. But what you can do is change the public's mind. Because the public already agree. Right? You don't need an information campaign. The public already get it. But, as I said at the outset, the problem is the public simultaneously believe that if we spent more on health and education, the sky would fall. Right? If the public believes the argument that's put to them again and again and again, if we spent more on health, if we spent more on education, if we spent more on infrastructure, if we protected the environment, the sky would fall. Right? And I want health, I want education, but here's the irony. The Australian public are willing to take short-term pain for long-run gain. And they actually, they're kind of being generous and sort of saying, well, I really want the health. But if you're telling me the best way to help the kids is to do without the health, all right, I'll go along with that. And this is the most cynical lie that's ever been told, but you've heard it more than once. Let me just give you a clear example of how bad this is. before I move on to what we could do about tax, which would collect enough money to solve every problem we can think of. 90% of Australians believe that we should ban junk food advertising during children viewing hours. 90%. 5% aren't sure, and 5% are opposed. 5%. You know, that's irrelevant. That's like the National Party's vote. Okay? I know, somehow they get to be Deputy Prime Minister with 5% of the vote. We'll leave that aside. So 5% of Australians think that we should run junk food ads during children's viewing hours. Can anyone remember the last time a major political figure from a major political party promised to do something as simple as that 90% of the public would? No, I can't either. And you know what? It's not going to happen. So let me be clear. The epidemiological evidence says we should be worried about obesity, we should be worried about kids eating sugar and box. Evidence, tick. 90% public support, tick. Is it going to happen? Not a chance. Not a chance. So, academia, people interested in policy, you need to rethink the role of evidence. You need to rethink the role of voters in democracy. Right? Ask me to come and give a seminar on how politics works, and I'll get halfway through it in an hour, but it does not work the way people have told themselves it does. And that's why we won't do any of the things that I'm about to explain about the tax system. Australia is one of the lowest tax countries in the developed world. Let me just say that again, that's not any ambiguity in what I said. We are one of the lowest tax countries in the developed world. And when I survey Australians and ask them, are we a low tax country or a high tax country, 2/3 of them say we're a high tax country, 1/3 of them say we're about average, and almost no one says we're a low tax country. Okay? Because even the Labor Party tells us that we need to cut taxes. Right? We've been told again and again we're a high tax country when those pinky leftover freaks at the OECD and the IMF say we're one of the lowest tax countries in the world. And it's actually quite boring for me as an economist to stand up and just read statistics. But I would probably spend a large percentage of my time talking to journalists and policymakers who just don't believe that we're a low tax country. I don't know what to do about that. We're a low tax country. We're a very low debt country. Our debt is low by international standards. Our debt is low by historical standards. We are what economists like to call a low debt country. Yet when I talk to people, I hear what a high debt country we are. Okay? That's all right. Over time, I've just come to understand that what the public thinks and what the facts show have got nothing to do with each other. The Australian public thinks more than 10% of the workforce is employed in mining. The ABS thinks it's 2%. We're 500% out. But don't worry, we all know the Tasmanians have got low education standards. The Tasmanians think that 20% of the Tasmanian economy is employed in forestry. 1 in 5 workers. The ABS thinks it's 1%, or 1 in 100. They're 2,000% out in their estimate of people in their own community and what they do for them. So the public has no idea about the economy that they live in. The public, the politicians either have no idea, which seems like we should sack them, or they're flat out liars, which I think means we should sack them. But which is it? Are they willfully lying to us, or are they completely ignorant about the circumstances over which they try to introduce policy? So, one of the reasons we find it hard to have a debate about tax in Australia is because people are lied to all the time. We think we're a high tax country. People think they're taxed highly by historic and international standards. They're not. The mining tax is a great case in point. How am I going for time? 6 minutes. 6 minutes, perfect. I don't use PowerPoints, I always finish on time. I always say perfect, because they're all wrong. The mining tax is a classic case in point. We've heard so much about the mining boom in Australia. Incredibly lucky we are at the mining boom. 98% of Australians don't work in mining. 98% of Australians don't. According to the ABS, the net present value of all the resources under Australia's ground, right, the coal, the iron ore, the gold, according to the ABS, if you dug it up and sold it all, the net present value, profit that you make doing that, it's about $700 billion. That's a lot of money. If you found that, you'd probably be pretty happy. Not happy enough to increase your life expectancy that much, but $700 billion worth of happy. You want to know how much? So Australia's got $700 billion worth of incredible resource boom coming our way. How much have we got in super? Have a guess. As a nation. $1.5 trillion. Twice as much. But twice as much financial assets in superannuation as the ABS says the mining moves worth. But what do we hear about our super all the time? Haven't enough. So $1.5 trillion in super isn't nearly enough, and we've only got $700 billion in mineral resources. $700 billion is only a lot of money when you give it to a few people. When you start, one of the best tricks in economics is to learn to divide. I'm a genius because I know where the divide button is on the calculator. So if you divide 700 billion by 23 million people, you start thinking, oh, it's not really that much. Over the course of an 80-year life, it's actually not much at all. But what's Gina Reinhardt worth? World's richest woman, what's she worth? 30 billion. Mining's great if a few people can handle to it. And that's the point. We tried to introduce a super profits tax on mining that sort of said, well, you know how world commodity prices went through the roof? Well, we should tax some of those incredible windfall gains and spread them out between all of us. The mining industry strangely went ballistic because we've got an entirely different idea. What if we went, no, we'll keep it? And Tony Abbott said, you might be onto something. That's a very good idea. Because if we were to take all that money from you and spend it on these people, you're right, that would be crap. Let's not do that. You hang on to it. So, the 98% of people who don't work in mining in our democracy failed to get a slice of the most incredible windfall gains, in the 20th century. And Gina Reinhardt's wealth is now she's one of the richest people in the world, and 10 years ago no one had heard of her. Why? Because an iron ore asset that someone gave to her dad went through the roof in value. We want to end the age of entitlement. And she was entitled to $30 billion worth of our natural resources that her dad never bought off the West Australian government. And when we suggested maybe you should pay a windfall gains tax, oh, the sky will fall, the sky will fall. Picture two people. Someone who goes to work for $50,000 and gets paid $50,000 in wage and salary, and someone who buys and sells shares and makes $50,000 in profit. Who do you think pays the most tax? So wage and salary earner pays twice as much tax. We have a 50% tax discount in Australia. 50% tax discount if you earn your money from capital gains. 50% discount. There is no economics behind this. When John Howard introduced it in 99 or 2000, everyone sort of, where'd that come from? That costs $7 billion a year, that discount. The people who don't work. Remember the age of entitlement? Remember how we want to encourage people to work hard and save? Well, actually, if you make money buying and selling stuff, 50% discount on your tax. Superannuation. Superannuation in Australia is, there are books that basically encourage people to take their money out of the Cayman Islands and put it into Australian superannuation. Where's Julie Smith? I heard it before. Yes. Julie put me onto this years ago. There is no better vehicle for tax evasion than Australian minimisation. It's not illegal, so it's not evasion. It's no better vehicle than the Australian superannuation system. According to the Australian Tax Office, there is an Australian with a self-managed superannuation fund with $100 million in it that they've put away to fund their retirement. $100 million in a self-managed super fund. And you know what we tell the public? Oh, it's taking pressure off the age. It's taking pressure off. Thank God these rich people are putting $100 million into a tax haven because it's taking pressure off the age pension. Well, here's a tip: if you've got $100 million, we were never going to give you an age pension. You're not taking pressure off anything. But literally, people don't believe me when I say this. So let me just say it really slowly, really clearly. If you're over 65 and pull money out of your superannuation, it's tax free. You pay no tax. This person, we don't know their name, we just know their balance. With $100 million, they can pull $10 million a year out of their super and not pay a cent in tax. In fact, they would be eligible for the $800 utilities bonus that pensioners and low-income earners get in Australia, because all of the money they take out of super, because it's tax-free, it doesn't count for the income test to see if they're eligible for their $800 utility bonus. I kid you. So, capital gains tax, superannuation. Superannuation tax concessions are the largest expense in the budget, and they're the fastest growing. They're growing by $5 billion a year. $5 billion a year growth. We're nearly at $50 billion a year in tax concessions to super, and according to the lefties in Treasury, the top 5% of income earners get 30% of the benefit, and the bottom 20% of earners get none. So we're spending $50 billion a year to, quote, help people save for their retirement, and we're giving 30% of that $50 billion to the top 5, we're giving none of it to the bottom 20. Now, the reason we don't care is because this is done through something called a tax concession rather than posting the check. But from an economic point of view, it's exactly the same thing. So imagine we came up with a save for your retirement policy where we posted checks for 30, 40, 50,000 bucks a year to high income earners. So if you put that in the retirement account, and then we posted checks for zero for the poorest people in the country. That's what our superannuation system is currently doing. We spend $5 billion a year subsidising the mining industry, $5 billion a year in federal money. We've got a paper coming out soon, first time look at the state government subsidies for mining. Probably going to blow everybody's socks off. Let's just say it's probably bigger than the federal government subsidies. And if you thought we were short on cash, understand that there is bipartisan consensus around the fact that we should spend $50 billion to buy 12 new subs to replace the 6 we haven't used. Okay? $50 billion to double the size of our submarine fleet. There is no shortage of money. And if there was a shortage of money, you'd go and collect some more. But there's $50 billion for subs, and that doesn't do anything to the debt. There's $40 billion for joint strike fighters, and it doesn't put pressure on the deficit. Do you want to spend some money on health? Oh, where would the money come from? Oh, you want money for your health program? Well, I have to take it from someone else's health program. Can you two fight amongst yourselves? Could you just fight amongst yourselves for a while we go give some more tax cuts to high income earners? So, I'll wrap up on that point. But if, and it's a big if, I don't believe it for a minute, if we wanted to spend a lot of money on health, we not only should, but we could. And if you don't want to take the money off Gina, or you don't want to take the money off the tax concessions, the super, or you don't want to make people who earn income from capital gain pay as much tax as you and I, that is, if you wanted to commit apparent political suicide by collecting more tax revenue by closing loopholes for rich people, even if you couldn't bring yourself to increase taxes on people who don't pay much, all those $50 billion in submarines should be taken off. But no. If you want money for health, you've got to find it in the health budget. Why? I've got the money. Thank you. ideology would be good. Because everyone loves talking about tax.
That's right. Well, now we've got 5 minutes to just have a few quick backwards and forwards questions. Jill.
I noticed in today's paper that the head of Treasury, Martin Carpenter, has mentioned other ways of raising the one of the is the scope of the GST. And a lot of reasons why we did it in the first place. And secondly, to reintroduce the indexation tax, which is the cost of $5 million there. I wonder if you'd like to comment about the implication of that for the environment and
Yeah, look, I saw Martin Parkinson, I saw his speech reported, I read it this morning. It seems interesting that he chooses to say that around now, but let me put it to you this way. I've been saying for 10 years that Australia doesn't collect enough tax and we should collect more tax if we want to do the things we want to do. And the only people who agree in the business sector, the only people who actually get it and actually want governments to go spend a bunch of money on infrastructure that they want, they know the government's not actually collecting enough tax to do it. But the business sector are frankly a lot smarter than the NGO sector and the public health groups and everyone else, because they've spent 10 years saying to themselves and each other, well, if we're going to have to collect more tax, which one do we collectively all want? I know, the GST, because we don't pay it. I know, fuel excise, because we don't pay it. So, yeah, look, of course we could collect more tax if we increase the GST, and I don't have a fundamental philosophical problem with that. I just can't see why we wouldn't tax Google first. I just can't see why we wouldn't get rid of the capital gains concessions first. I can't see why we wouldn't close the loopholes that are seeing tens of billions. Like, really, it's not a public health program you want that doesn't actually just look like rounding error when it comes to foregone tax revenue through these loopholes. So, yeah, it's good that Martin's admitting it, Ken Henry's admitted it. Frankly, everyone knows it's true. But, you know, you've still got bipartisan consensus saying, oh, no, we're all very keen to reduce the deficit and determined to not increase taxes. Well, you know, imagine a low-income earner that said, I'm determined to move into a better house, but I refuse to work more and earn more. You want to use a household analogy? Our government household refuses to earn more money. And again, we're one of the lowest tax countries in the world. So yeah, GST, I think it's not an accident that that's where the pressure's coming, because businesses don't pay the GST. It's paid for by you and I. So of course they can agree that's a good way to start. What was the second part of your question? Oh, fuel taxes. Well, again, I mean, most of those, you know, from big businesses' point of view, they're not paying those excises. So, yeah, but we should have never done it. You know, the Howard government, which again was pretending to be concerned about the long-run impacts on the budget, made some very expensive long-run decisions like scrapping the excise. But also, don't forget, one of the last things John Howard did before he lost office was double the means test and assets test for the age pension. He was so worried about the cost of ageing, you can now have $1 million in cash as well as your house and pick up a part pension. You know, so yeah, there was some poison pills slipped in the 2000s. Fuel excise was a silly.
Richard, where does ideology begin and economic fashion end?
Well, this is why, you know, I like Jeff and I'm glad we're launching the book this afternoon, but I think it's just such a missed opportunity. This is economists. I think you need economists to help you win these fights. You want to sack them all, you know? This is all, it's not even ideology. This is just power and money. I mean, if ideology was driving this government, then why are they determined to not have a market-based mechanism to tackle climate change? Right, forget this notion that some economic rationalist is camped somewhere in Canberra dominating policy debate. I mean, we'd probably be better off if they were, because this is crazy talk what we're doing. So I can't even see a strong sense of ideology. It's just delivering for the status quo. But it's not economics, you know. And all that you heard this morning about austerity, yeah, I mean, it's fantastic data. It tells an entirely different dimension of the austerity problems. But don't think that economists don't know that austerity doesn't work. You know, and don't forget, in Australia, even the coalition was supporting the stimulus package in 2009. Though it's quibbling about its size.
It's time for one too. Well, I think you got the prerogative.
Richard is always maybe rally us up to, for God's sake, this is just outrageous. We're in the room because this is to do something about power, money, resources. So we're here wanting to challenge the status quo. And I suppose I was reflecting on the lessons from Europe and elsewhere around the world, and somebody somewhere politically made a decision that they didn't want to do it in austerity, they wanted to do it in a way that was good for the country. And we can, I'm sure there's all sorts of perspectives, the economists and the non-economists, around what you've said. But can you take us to the next step? So whilst you've demonstrated some fantastic evidence in your talk as well, I hope that you've fantastic evidence in there. We've seen the evidence from around the world, but getting to the next step, and many people are going to answer it, is talking governance and power. But if it is, then I truly believe it's all about the inequity in power, and then it plays out through money resources. What are the mechanisms that we use, the tactics, the strategies that we need to use to shift that, shift the status quo?
Look,
You've only got 2 minutes.
I was going to say, I'll give you the shortest answer I can, and it is a pretty short one. And that is to say, and I'm actually writing a book at the moment, Brent Rosser, who used to work for the Xenophons. We're writing a book which kind of is an entirely different take on the role of evidence in policy. Let me be clear, I'm an economist, I'm a researcher, I run a think tank, I do research and evidence matters, sometimes. It matters sometimes, and it's entirely irrelevant sometimes. And we need to have a predictive model for when it's relevant and when it's not. So here's mine. Give a seminar on this soon, I hope. I think there's an inverse relationship between the role of evidence and the political significance of the issue. Good. Seems like people get it. All right. If it's boring and no one cares, let's have a look at the evidence. If it's red hot and everyone's passionate, no one gives a stuff about the evidence. So we actually need to have a think about why evidence matters sometimes, why it's irrelevant other times, who it matters to. And here's the bit that you're not going to like. When I'm guessing, generalising, I don't really know you all, but my hunch is when you think about evidence, you think, all right, so there's some objective policy maker who, if only I can put the evidence in front of him or her, scales will fall from their eyes and they'll do this. Fine, it happens when things are boring and no one cares. Here is the bit that gets left out. Who wants the opposite of what I want? Who wants no change? Who wants to go the other way? And what's he up to today? What's she doing right now? Because I hate to say it, I talk to people all the time who are passionate about changing policy in some direction, and I say, who's trying to do the opposite? What do you mean? Well, if it's a contest of ideas, what are you fighting against? And I hate to say it, I think academics get very caught up in my evidence is compelling, I'm completely persuaded. Well, someone else wants the opposite. If it's important, if it's big, if it affects power, then there is someone that likes things just the way they are, and they're busy too. You need to factor in what they're doing in what you're doing. Otherwise, you do what I think of as playing chess against yourself. You know, and I'll move there, and I'll move there. And like my 6-year-old, I beat every time. Not very good at chess, but I always beat my 6-year-old. because he's always going straight for my king. And it is inconceivable to him that I'm actually going to make a move. He's just waiting for his turn to do his next thing. So if you want to win, you've got to figure out who you need to beat. You haven't got a strategy for beating them.
On that note, we need a cup of tea, I think.
Oh, thank you. Great, thank you. I'm one of the organisers.
Okay, let's recommence. Move from the economist to the lawyer, philosopher, and political science. So this is a nice conjunction that Peter was referring to us. He works in RegNet at ANU and is going to talk about who has the power. Thanks.
You should save the applause till later. You might not like what you hear. Okay, well, thanks very much. This topic, power, who has it, how is it used, was not a topic that I chose, but rather was assigned by Sharon, being a compliance sort of fellow. And she does seem to have some power. I listened, as it were. Let me begin by saying that power has been a cross-cutting theme in many disciplines. In fact, it's hard to think of a discipline that doesn't talk about power in one way or another, whether we're talking about economics, philosophy, history, political science, international relations. And indeed, if we go back in history and we remind ourselves of some of the great texts in some of the disciplines that I've mentioned, for example, Machiavelli's The Prince, or if we go back even further and we think about what Thrasymachus said to Socrates in Plato's Republic, it follows that there haven't just been hundreds but thousands of years of theorising about power. Now it also follows from what I've just said that I'm not about to say anything new or indeed anything insightful that hasn't already been said over the last couple of thousand years. So all I'm really going to do is to remind us of some of these insights and how it relates to the present context rather than the more abstract themes that the social sciences pursue. Having said that, let me begin in an abstract way and with an abstract distinction. The distinction between structure and agency is another one that is to be found in all of the social sciences. An enormous amount of theorising around these two concepts. Let me offer two very simple definitions. We can think of structure as an arrangement of norms with pervasive effects. And so an obvious example of that is the law itself. The law is an arrangement of norms and it has pervasive effects. Agency, an individual actor with the capacity for planned action. If I were a philosopher, I would be talking about intentional action, but that gets complicated, so let's just stay with planned because we are all creatures of planning. And to some extent or another, we all have capacity. So this simple dichotomy, or we can think of it as a continuum, which has been so important in theory, allows us to extract some very simple propositions. An arrangement of norms can render actors structurally weak or powerful. Now there are obviously many, many examples of this we can think of. Just think of the IMF, for example, which has been mentioned once or twice. If we put on our political science hat, we would characterise the IMF as a voting game. And if we were to look at the IMF's voting rules, we would see that supermajorities were required in certain contexts, meaning that you required 85%. And if you were wanting to be a veto coalition, you would need 16%. And then we would look at the allocated quota that the United States has and see that it has 16%. So that's an example of rules for an arrangement rendering somebody structurally powerful. All the BRIC countries put together have about 12%. So even though they're economically powerful, they're not powerful in the context of IMF voting games. There are many other examples. Clearly a cartel by coming together, agents coming together and colluding, restricting supply, raising prices, an example of a structurally powerful group. The million-dollar question to which the social sciences have tried to contribute over hundreds of years, particularly in the last 100 years, is to what extent, if at all, can agency change the effects of structure? That's the deep, abstract question which has preoccupied theorists in many, many different disciplines. Questions about agency have become particularly salient ever since globalisation is reported to have taken place. Globalisation, of course, is a very old phenomenon, but we think of the Roman Empire and so on, even the United Kingdom or parts of it were on the Roman currency. These days, globalisation has made the question of agency particularly salient because more and more normative arrangements seem to come out of international sites of power. So the idea here is that these normative arrangements, these forms of structural power, emanate less from nation states and more from various global fora. So, let me begin by trying to now bring these abstract questions and using the distinction between structural power, agents power, say something about the types of power that we can identify in the world and who is able to harness it and under what conditions. So imagine for a moment, and I'll try and make this, I should say that I'm not a health specialist, health is outside of my area, and so in that respect I'm very uninstructed and naive, as it were. Nevertheless, I'll try and make my examples relevant to the trade context and to globalisation more generally. Imagine for a moment that you're a health activist or a health professional and you see that the United States and New Zealand are negotiating a free trade agreement. This is a hypothetical. And you're very concerned about the text that the US has tabled. It's full of chapters that seem to have rather dramatic implications for health, and in particular you're worried about things such as the investment of the state. The investor state chapter, you're worried about the intellectual property rights chapter, and you go to the New Zealand negotiators and you lay out your concerns. And the New Zealand negotiators say to you, you're absolutely right, this is a shocking text. We completely understand your concerns, you're right about the evidence. The evidence here is overwhelmingly in favour of redrafting this text, especially on the IP rights, on the services side of things, and on the investor state stuff. And you're very cheered by this fact. And over the next 2 years, you gain the attention of the New Zealand trade negotiators, and it appears that they're listening, as if they're taking your concerns, indeed the concerns of the entire health community, on board. You wake up one morning and you find that New Zealand and the United States have indeed signed this free trade agreement, and your worst fears are realised. All the bad language that you thought had been removed is actually there. What has happened? What has gone wrong? Well, it may be that the New Zealand negotiators did understand all the evidence that you brought to them, and they understood precisely what would happen if indeed they did sign the agreement and it turns out that they signed. Why did they agree to such a text? A possible hypothesis here is that they were, and you were part of what's called a nested game. This is a branch of game theory in economics that does a lot of work, trying to understand or make us see that the payoffs in one forum may be affected by the payoffs in another forum. The idea that many people are caught up in nested games. So what's the nested game here? The nested game could be the security arrangements between the United States and New Zealand. So New Zealand, as you probably all remember, suspended, or rather prevented US aircraft carriers docking in New Zealand that were carrying nuclear weapons. As a result of this, the United States suspended the ANZUS Treaty. And ever since then, of course, New Zealand has been trying to come into the cold, as it were. Now, this has progressed fairly well. New Zealand is on much better security arrangements with the United States. Nevertheless, it might well see that the free trade agreement is an opportunity to cement this security relationship. It has a desperate desire to be part of the Five Eyes arrangement, the security arrangement. There are so many coalitions out there, I always struggle to remember their names. So they signed this particular agreement. It's very difficult when you're in a nested game and you don't even know it to take, as it were, countermeasures. And nested games are a fact of life. So in other words, guns, military power, military coercion, all of these things have become less relevant in the long in the long span of human history. States go to war less than they used to. The fact that military coercion is less a variable in the arrangement of human affairs does not mean it is irrelevant. And guns as a variable, or military power as a variable, is very important to understanding all sorts of things, including trade negotiations. So let's take another example. Imagine you're the United States and you're confronted by a free riding problem. You want a globe and everyone is taking your intellectual property. What you decide to do is to globalise an intellectual property treaty regime. The problem here is you have to persuade the other 189 countries to make wealth transfers to you, because you're the only net intellectual property exporter in the entire system. So here's a table. This relates to work that I did about 20 years or so ago. The table of countries represents all of the countries that were part of the Uruguay round of trade negotiations that resisted the US agenda on intellectual property rights. Now, the dates represent the occasions on which the US threatened or indeed imposed economic sanctions on all of these countries. And what you'll see there is that almost every country was targeted during the course of these negotiations, which essentially took place between 1986 and 1993. So in other words, the answer to the question I posed a minute ago, how did the United States persuade these countries to sign on to an intellectual property agreement that was clearly against their interests, was the threat of economic coercion. Now, the countries that, against which the United States took no action are examples of countries against which it was already in quite a lot. I mean, it couldn't do more to Cuba than it was already doing. And in Nicaragua, the Reagan administration was paying the Contras to murder and mutilate their way through Nicaragua, so more or less they couldn't do much more to Nicaragua. So all of these countries came under extreme pressure, and one by one they followed. India was the last one to follow. It followed in 1993. So money. So far, I've talked about guns and money as sources of power. Now, in the case of money in our world, and especially in the context of trade agreements, import markets are what matter, not your capacity as an exporter. And here's some data from 2011. The capacity of the United States to impose economic threats on other countries is very large because it is a very large import market for many countries. You can see it's the biggest in the world. US imports 12% of the world's merchandise goods and 10% of the world's services. China is catching up very quickly. If you'd looked at this data 4 or 5 years ago, China was sitting at about 6 and 4% respectively. But have a look at India. It's much less a significant import market than Brazil. And of course it follows from this that most of the other countries in the world have trivial import markets by comparison. And so their capacity to mobilise economic coercion is rather limited compared to the United States and China in the future. Now at this point, you're probably thinking this is a really rubbish account of power because I seem to have completely neglected the last 100 years or so of social theorising about power. I mean, when we think, for example, of the work of the later Wittgenstein on language and its relationship to reality, how language, in some sense or other, shapes my perceptions of reality. Or we think of the work of Foucault on networks of power, how power is not a thing, but something that flows through networks. Or indeed of the earlier schools, for example, the Frankfurt School, the work of people like Adorno and Horkheimer, who really asks us whether indeed ideology had put a stop to the seemingly inexorable march of dialectical materialism. Surely you would say to me, and indeed you might even quote the words of that arch-structural determinist Amy Karl Marx, men make history, but in circumstances not clear, they choose it. So the idea here, implicit in that dictum, Marx's dictum, is that agency matters. Even he thought that agency mattered. And so far in my account of power, I've completely neglected agency. I've given you examples of structural power. Power that the United States can harness, but not individuals, and certainly not smaller states. So, we need to deepen, make my account more subtle. I don't want you to go away thinking that power looks like this. That's how. So what are the softer forms of power in our world that non-state agents can draw upon? Well, one very, very important form of power here is technical expertise. Evidence actually does matter. What matters, though, is that you have to be able to focus this technical expertise at critical nodal points. So evidence doesn't have a general diffuse effect. You have to be able to concentrate this expertise on particular nodes of decision-making power. So one of the reasons the United States was able to forge the TRIPS agreement was not just because of economic threats, but because it had more patents experts than anybody else in the world. In 1986, when it negotiated the first bilateral treaty on intellectual property with South Korea, there was one South Korean academic who had done half a semester of copyright. That was the sum total of the expertise that the South Koreans could call upon. And without going into this long, complicated story, one of the reasons we have much better outcomes now on HIV/AIDS treatments and so on is because there are a wealth of patent experts working with developing countries now to get better outcomes in all sorts of ways. Because the United States can no longer walk into a negotiating room and have a dozen patent experts and the other side have none. In actual fact, the balance of technical expertise in the world, and I could show you this for many different areas, has been dramatically recalibrated. And that means technical expertise, properly focused and concentrated, does make a difference to outcomes. Information gathering networks. I've interviewed many trade negotiators over the years for various projects of one kind or another, and they all pretty much say the same thing. Information in trade negotiation is power, which perhaps accounts for some surveillance activity we've been very powerful. Every country in the world has the capacity to rearrange its information gathering networks. And of course, the hyperconnectivity of the world means that information travels very fast. And at the global level, I would argue that there is much more transparency than we've ever had. Paradoxically, there is more transparency at the global level than at the national level. You can often find out more about what's happening in an Australian trade negotiation from WikiLeaks or talking to foreign NGOs than you'll ever get from DFAT. Foreigners know more about our trade negotiations than we do. Information gathering networks are profoundly important. And if you want a good example of a country that's rearranged its information gathering networks for trade, then you should look at the way in which Brazil has completely reformed its system. It's probably the most sophisticated and adept negotiating group on many issues. You know, I will always be backing the Brazilians in the negotiating contests. They're charming, they're savvy, etc. I'm not going to go into the details. This is the US model. The point I want to make is that every country has a model, and there's nothing to stop you from designing better information gathering model. A second form of power that we can all utilise, a third form of power that we can all utilise, is to build circles of consensus. And again, if we study the way in which the United States operates, it isn't just about hard power. The United States is extremely instructive on questions of soft power, how to deploy soft power. That, in a sense, counts for many of its successes. So again, if we go back to the TRIPS agreement, the WTO round, the United States first forged a consensus with the European Union. So step one is to create an inner circle that decides on what the agenda is, on the direction that things will go. But at this point, you'd be crazy now to go to the hard tools of power, the economic coercion, the military threats. You try and expand the circles of consensus. You bring other players in. So obviously, in a multilateral context, you'd be thinking about Japan, and in the context of the 1980s, you would have thought about Canada. You wouldn't think about Canada anymore. It's pretty much irrelevant in the scheme of things there. And then you'd form some, as they did in the 1980s, a Quad Plus group. Now the beauty of this process is you're bringing people into a circle and they feel charmed, as it were, by being part of an inner circle. Who doesn't feel charmed by being part of an inner circle? So the way in which the United States worked on intellectual property was to bring more and more people in, giving them a hint of what it was like to walk in the corridors of power. Then they created a Friends of Intellectual Property group, and there were toadies like Australia, loyal and faithful allies like Australia were admitted into this inner circle and made to feel important, flown to the various hotels where they were presented with very helpful draft texts of the relevant trade agreements. So we see that the United States steadily built these circles of consensus. But of course, building circles of consensus, in other words, networks, is something that is open to anybody and many agents to do. And in fact, explaining a lot of the world's outcomes today, as I'll hope to make clear, is a combination of soft forms of power, not just hard forms of power. Framing. Framing is a very important idea that's talked about within psychology. within behavioural economics, but Aristotle says everything you need to know about framing in the rhetoric and the rest of the time. Just fill in the data points. Basically, how something is presented affects the choice that people make. Richard Dennis talked about this and so on. The important point about framing is that it's the act of presentation that is more likely to influence your choice than the assessment of evidence. So, do we have real live world examples of framing having worked in these big geopolitical stories I'm telling? What do you think this is about? Well, it's about piracy, obviously. See, Microsoft Windows, somebody standing, looks Asian. There's something going on here. These don't look legitimate copies. Stealing from the mind. This is the title of an article that appeared in the New York Times in 1984. US multinationals had seeded the US media with lots of images like this, and lots of frames. So by the time they came to Congress and asked the United States Trade Representative to drop the huge levers of power and pull those huge levers of power, there was already a frame in place. All these other countries were pirates. Now you might say, well, can the weak agent make use of framing? I just want you to consider this win-loss sequence, and I'm going to concentrate on the Doha Declaration of 2001, which is generally characterised as a win for developing countries. This is the declaration that came out of the WTO on the issue of public health and intellectual property rights. Here's another big owl, this time it's Al Gore. Al Gore is running for president, and in the background you have a bunch of HIV/AIDS activists. There was a certain inglorious episode in Al Gore's life when he was vice president. He was a leader in helping the Democratic government bring the Democrats under Clinton bring huge pressure against South Africa for daring to import HIV/AIDS medicines. This is probably an episode that he'd best like to forget in his life, but we can forgive him since he's done much more than any other politician in the world to alert us to the problems of climate change. What happened during the election was that HIV/AIDS activists got a wind of this, and everywhere he went, they went. And it wasn't just HIV/AIDS activists. Many people began to question US trade policy on HIV/AIDS. If you were to look at that period in the media, there were many articles about the moral bankruptcy of the United States position. What was going on, of course, was one giant reframing act. So it was no longer that Kenya and South Africa were pirates of US intellectual property. Rather, they were putting patents, profits before human lives. And there's a lot more to say about this story, but ultimately it led to the Doha Declaration on Truth and Public Health. An extraordinary victory, an extraordinary victory. Enabled by this kind of activity. So, framing is a tool that the weak can use. Agenda setting and forum shifting. One way in which to exercise power is to control the agenda. Agenda setting is a very commonly talked about form of power within the political sciences. And of course, if you don't like the outcome in one particular forum, you don't like their agenda, you might shift the forum. And again, in some work I did with my colleague John Braithwaite, we were able to show how the United States routinely shifts forums. From, for example, the World Intellectual Property Organization to the GATT to the WTO. If it doesn't like what the IMF is saying about the gold standard, it simply abandons the gold standard and forms its own forum until things settle down. Well, what I think is interesting is that when we look at the world today, it's clear that a lot of forum shifting is potentially in the hands of weaker partners. So that if you don't like the forum in which the US has set the agenda, look at other fora that can bring power to bear, that can create a new kind of agenda. So forum shifting as a way of changing agendas is as much in our world today open to the weak as it is to the strong. So, I would say that the Doha Declaration on TRIPS and public health is an example of all of these things coming together. Very good legal technical analysis provided by experts from NGOs and from developing countries. Framing, Gore's greed kills. The unity of developing countries, circles of consensus. And finally, broad-based coalitions of states integrated with NGO networks. When all of these things line up, the world changes in a way that I think most of you in this room would say is positive, is good, welfare. Look at the current trade negotiation involving the TPP. If you're New Zealand and you're being outflanked, what is it that you'll do? Well, if we follow these strategies I've been talking about, first of all, you'll build circles of consensus. You'll go to Vietnam, Chile, Brunei, Peru and Malaysia. You might not bother with Singapore and Australia since they seem to be too strongly in the US camp, and you'll create a coalition. Let's say you're worried about generic medicines. You're worried about the access to medicines issues. Who might be allies against the United States in all of this? Well, perhaps the US generic industry. Perhaps they don't have so much to gain from patents. So, you go to Alpha Farm in Australia, which is a subsidiary of Mylan. You tell Mylan your concerns, and the hope is that Mylan will form some sort of counterweight to Pfizer. Looking for ways to divide and conquer US business is incredibly important. If US business remains united in a trade agenda, then almost certainly US business will have reached out to European business. And that's the beginning of a circle of consensus that makes it difficult for you to win. So you have to look for ways in which to divide US business. And that's easier than you think. So, 3 prescriptions. This is my final slide. There are different types of soft power available at low cost to the weak. It's easy to get technical expertise these days. You just need to trawl the internet. There's lots of it out there. Achieving outcomes depends on networked combinations of soft power. Right? It's not a matter of just grabbing one lever of power. And not even the United States, which if you're an international realist theoretician of a realist kind, not even the United States grabs one lever of power. It's not this giant, gargantuan machine that rides roughshod everybody. It operates in much more subtle ways than that. And we can learn from that. And one of the learnings here are these network combinations of different kinds of soft power. And lastly, in a hyper-connected world, there are lots of partners at work, which means there are lots of possible networked combinations. Obviously, you're going to lose battles. If you're in a nested game, there are just things you can't, situations in which you can't win. So one has to expect defeat, obviously. But at the same time, there'll be many opportunities for victories or partial victories. So the world actually is not as structurally determinate as when I began. It's much more open, much more fluid. And that has never been truer, and I suspect will increasingly grow truer. Thank you very much.
Thank you very much, Peter. That's open. We've got time for a few questions before the panel.